I'm waiting for Dr. Atul Luthra. He's a senior endocrinologist and diabetologist at Fortis Hospital, Gurgaon. I have two specific questions for him. One is, do people with thyroid disorders are more vulnerable to COVID-19? I myself is suffering from hyperthyroidism from years. I take regular medication. And there are 42 million people in India who are suffering from thyroid disorders. And my second question is, people with diabetes, do they need to follow any extra care or precautions during this situation of COVID-19? So let's hope he comes soon and we'll find our answers.
Hello everyone, this is Dr. Atul Luthra. I work at the Fortis Hospital, Gurgaon. And the two most common problems that we encounter, especially in women, are thyroid disorders and diabetes mellitus. Now, with the current scenario of a global epidemic of the COVID-19, there are many questions that come to the mind about vulnerabilities in people with thyroid disorder and diabetes. Also, let me put it very straight, there is actually no predisposition for COVID-19 infection in women suffering from thyroid disorder. There is absolutely no relation. Thyroid disorder is an autoimmune disease wherein your antibodies are made by your own immune system. It is not related to any virus or bacteria or any extra body pathogens or bug. So it is not related to in any way, thyroid disorder is not in any way related to the COVID-19. The question with diabetes is more pertinent because yes, as we know, the severity of COVID-19 infection can vary from a mild self-limiting flu-like illness to a serious disease with respiratory complications and even death. As you know that diabetes is a state of impaired immunity. Diabetes patients are more prone to develop infections. Infections take a more serious course and have more unfavorable outcomes. We as a practice, especially in elderly diabetics, follow the practice of immunization for flu, influenza and pneumonia. And with this ongoing epidemic of COVID-19, we recommend that these patients should follow certain extra precautions compared to the general population. The most important is to maintain a good nutrition and a good hydration. So diabetic patients should do the extra bit of glucose monitoring, make sure that the sugars are well controlled, take their medicines regularly, not to skip doses, take a good nutrition. You see, your defense, your immune defense is dependent on a good nutrition status. Hydrate yourself well, don't be dehydrated. Obviously, we are not venturing outdoors much, but even within the house, maintain a good nutrition, good balanced diet intake and good hydration. And check your blood sugars more often. That is the best you can do because diabetic patients, their immune systems are not healthy. The leukocytes or the white blood cells, they are the lazy leukocytes as we say in diabetes. So that is the message I would like to convey to diabetes patients with the ongoing pandemic of COVID-19.